Welcome back to Clarity Education Systems and www.pmhmptesting.com. I'm Dr. John Rossi, and in this video, we will be continuing our discussion on neurotransmitters, specifically dopamine. Let's start with a quick review of neurotransmitters and recall that they are chemical substances produced within neurons that transmit signals across the synapse and whose neural functions range from basic reflexes to complex cognitive tasks. They are important in psychiatry because imbalances in neurotransmitters like serotonin, dopamine, norepinephrine, and GABA have been linked to various psychiatric conditions. Recall that many psychiatric medications like SSRIs, antipsychotics, and mood stabilizers work by modulating neurotransmitter activity, either by affecting the release, the reuptake, or receptor binding. Understanding each neurotransmitter is extremely important, as you will see this information on your PMHMP certification exam. You need to go beyond memorization and be able to apply concepts to actual scenarios and clinical management decisions. Our role is to understand the fundamental mechanisms that underlie medications. Grasping the complex interplay of neurotransmitters arms us with the knowledge to make informed clinical decisions, educate our patients, and further the field of psychiatric medicine and nursing. Dopamine is a crucial neurotransmitter within the central nervous system, playing a multifaceted role in regulating a vast array of physiological and behavioral processes. Historically first identified for its role in motor control, investigations have illuminated its pervasive influence on functions ranging from reward and motivation to learning and mood regulation. Chemically classified as a catecholamine, dopamine is synthesized in specific neurons through a cascade that initiates with the amino acid tyrosine and proceeds through intermediary molecules such as L-DOPA. Structurally and functionally, the dopamine system comprises distinct pathways within the brain, including the nigrostriatal, mesocortical, mesolimbic, and tuberoinfundibular pathways, each contributing to different facets of its overreaching influence. Several key factors underscore the importance of dopamine in the domain of neuroscience and psychology. Firstly, its dysregulation has been linked with a plethora of neuropsychiatric conditions such as Parkinson's disease, schizophrenia, and addiction, underlining its clinical relevance. Secondly, its involvement in the reward circuit has provided insights into the neurobiological underpinnings of pleasure, addiction, and motivation. With advancements in molecular biology and imaging techniques, the understanding of dopamine receptors, their subtypes D1 through D5, and their distribution patterns has added layers of complexity and precision to the therapeutic interventions targeting the dopamine system. While traditionally viewed within the confines of synaptic transmission, recent work has illuminated non-canonical roles for dopamine, including its function as a neuromodulator and its impact on synaptic plasticity, cellular metabolism, and even neurogenesis. Such diversity in function and role necessitates a rigorous and multidimensional approach to studying dopamine, making it both a challenging and exciting area of research in modern neuroscience. So let's focus in on what you need to know in order to pass the certification exam. Dopamine is a versatile neurotransmitter with roles in various physiological processes. Here are some of the key roles of dopamine. Motor control. The nigrostriatal pathway, which originates in the substantia nigra and projects to the striatum, is crucial for motor control. Dysfunction in this pathway, such as the loss of dopaminergic neurons in the substantia nigra, leads to characteristic motor symptoms. Reward and motivation. The mesolimbic pathway, specifically the ventral tegmental area, or VTA, to the nucleus accumbens projection, plays a pivotal role in the brain's reward system. Dopamine release in the nucleus accumbens is associated with pleasure, reward-seeking behaviors, and reinforcement. This system is also heavily implicated in addiction. Cognition and executive functions. The mesocortical pathway, which projects from the VTA to the prefrontal cortex, is involved in a variety of higher-order cognitive functions, including working memory, attention, and problem-solving. Regulation of hormones. The tuberoinfundibular pathway, which extends from the hypothalamus to the anterior pituitary, regulates the release of prolactin, a hormone responsible for milk production. Dopamine acts to inhibit prolactin release. Drugs that block dopamine can thus lead to elevated prolactin levels, a condition termed hyperprolactinemia. Dopamine is implicated in the regulation of mood and emotional responses. Low levels are associated with feelings of apathy, lack of interest in life, and low motivation. Dopaminergic signaling is involved in synaptic plasticity, the process by which synapses strengthen or weaken over time, which is fundamental to learning and memory. Some studies have suggested that dopamine might play a role in modulating pain perception and certain pathways of the brain, influencing both the emotional and sensory components of pain. Dopamine plays a role in regulating sleep-wake cycles. For instance, dopaminergic agents are used to treat disorders like narcolepsy. Dopamine has been shown to influence eating behaviors, particularly in the context of the reward value of food. Dysregulation in the dopaminergic system has been implicated in certain eating disorders. Dopaminergic pathways, particularly those involving the ventral striatum, have been linked to social reward and social behavior in numerous studies. It is worth noting that dopamine does not act in isolation, but interacts with a multitude of other neurotransmitter systems to exert its effects. Its actions can vary widely based on specific receptor subtypes it binds to, the brain region it acts in, and the signaling pathways it activates. A deficiency in dopamine can result in a variety of neurological, physiological, and psychological symptoms. The manifestation of these symptoms depends on the specific brain regions and the pathways affected. Here are some of the consequences of dopamine deficiency. Motor symptoms. This is one of the most recognized conditions associated with dopamine deficiency. It occurs due to the degeneration of dopamine-producing neurons in the substantia nigra, which is part of the nigrostriatal pathway. Symptoms include tremors, bradykinesia or slowness of movement, postural instability, and muscle rigidity. Dopamine deficiency is believed to contribute to certain types of depression characterized by anhedonia, inability to feel pleasure, reduced motivation, and fatigue. Reduced levels of dopamine in the prefrontal cortex can impact executive functions, leading to problems with attention, problem-solving, and working memory. This is often seen in conditions like schizophrenia and ADHD, although other transmitter systems are also involved. Reduced motivation and drive. A lack of dopamine can result in decreased motivation, initiative, and interest in activities that were previously enjoyable. This is what we term anhedonia, that reduced ability to experience pleasure from activities that were previously enjoyed by the patient. Endocrine disruptions caused by hyperprolactinemia. A decrease in dopamine activity in the tuberoinfundibular pathway can lead to increased secretion of prolactin from the pituitary gland, leading to symptoms like galactorrhea, unexpected milk production, menstrual irregularities in women, and decreased libido in both men and women. Sleep disturbances. Individuals with dopamine deficiency might experience disruptions in their sleep-wake cycle, including difficulty falling asleep or staying asleep. Orthostatic hypotension. This involves a drop in blood pressure upon standing, which can be seen in conditions like multiple system atrophy, where dopamine-producing neurons are affected. Also, restless leg syndrome. While the exact pathophysiology of RLS is not entirely understood, imbalances in dopamine have been proposed to play a role, and dopaminergic agents are often used in treatment. Excessive dopamine activity or overstimulation in certain brain regions and pathways can result in various neurological, physiological, and psychological symptoms. Here are some of the consequences of dopamine excess. Psychiatric symptoms. Hyperactivity of dopamine, particularly in the mesolimbic pathway, has been hypothesized to play a role in positive symptoms of schizophrenia, such as hallucinations, delusions, and disorganized thinking. Many antipsychotic drugs used to treat schizophrenia work by blocking dopamine receptors, specifically the D2 receptor subtype. Mania. Elevated mood, increased energy, and reduced need for sleep and impulsivity are observed in manic episodes of bipolar disorder and are believed to be associated with increased dopaminergic activity. Chronic use of certain antipsychotic medications can lead to tardive dyskinesia. This is characterized by involuntary repetitive movements, especially of the face, lips, and tongue. It is believed to arise from sensitization of dopamine receptors after prolonged drug exposure. Dystonia involves sustained muscle contractions leading to twisting and repetitive movements of abnormal postures. An overactivity of dopamine, especially in response to certain drugs, can contribute to dystonia. Addiction and substance use disorders. Many addictive drugs, including cocaine, amphetamines, and methamphetamine, increase dopamine levels in the brain's reward pathways, leading to feelings of euphoria. Chronic use can alter the dopaminergic system and contribute to addiction. Neuroleptic malignant syndrome, or NMS, is a rare but serious reaction to antipsychotic drugs, characterized by fever, muscle rigidity, altered mental status, and autonomic dysfunction. While the exact mechanism isn't entirely understood, it is believed that a rapid reduction in dopaminergic activity might play a role. Please see our video covering NMS for more information. Behavioral effects, compulsive behavior. Excessive dopamine, especially in response to certain medications like those used in Parkinson's disease, can lead to compulsive behaviors such as gambling, eating, shopping, or sexual activity. Other symptoms that we need to look out for include increased dopaminergic activity that results in restlessness or agitation. We also see nausea and vomiting in chemoreceptor trigger zones in the brain, which induce vomiting when stimulated. These have dopamine receptors. Excessive dopamine stimulation in this area can lead to nausea and vomiting. Dopamine receptors are a class of G protein-coupled receptors that are pivotal in mediating the effects of dopamine. These receptors can be found throughout the brain, with each subtype having its distinct regional distribution and functional properties. There are 5 identified subtypes of dopamine receptors, which are classified into 2 main families based on their structural and functional characteristics. D1-like family, D1 receptors. These are primarily located on the striatum, nucleus accumbens, olfactory tubercle, and the frontal cortex. Now, activation of D1 receptors stimulates adenylate cyclase, leading to an increase in cyclic AMP or CCAMP levels. D1 receptors play roles in motor activity, cognition, and mood regulation. They've been implicated in conditions like schizophrenia and drug addiction. Next, we have D5 receptors, or D5R. These are found in the hippocampus, hypothalamus, and frontal cortex, among other areas in the brain. Like D1 receptors, D5 receptor activation, it really stimulates adenylate cyclase. This subtype is less well understood compared to D1, but they are believed to play roles in cognition and possibly renal function. D2-like family, D2 receptors, located in the striatum, olfactory tubercle, and nucleus accumbens, as well as in lesser densities in other areas. Activation of D2 receptors inhibits adenylate cyclase, therefore reducing CCAMP levels. They play a critical role in motor control and are the primary target for most antipsychotic medications. Dysregulation in D2 signaling is associated with conditions like Parkinson's disease and schizophrenia. D3 receptors, found in areas like the nucleus accumbens, olfactory tubercle, and islands of chalasia. Like D2, activation inhibits adenylate cyclase. They have been implicated in mood and emotion regulation and might play a role in drug addiction. D4 receptors. Their distribution is more diffuse, but includes the frontal cortex, midbrain, and amygdala. Similar to D2 and D3 receptors, D4 activation inhibits adenylate cyclase. Variations in D4 receptor genes have been explored in relation to attention deficit hyperactivity disorder and other neuropsychiatric conditions, although findings have been mixed. To review, key functional implications include synaptic transmission. Dopamine receptors modulate the excitability of neurons and shape synaptic transmission in various neural circuits, influencing behaviors like motor control, reward processing, and cognition. Neuromodulation. Dopamine can exert modulatory effects on other neurotransmitters, such as glutamate and GABA, via its receptors. Behavioral responses. Given their widespread distribution, dopamine receptors play roles in a wide array of behaviors, from basic motor functions to complex cognitive tasks. Clinical applications. Dopamine receptors are therapeutic targets in various conditions. For instance, antipsychotic drugs often act as D2 receptor antagonists, while treatments for Parkinson's disease aim to restore dopamine receptor activity. Understanding the specific roles, functions, and signaling pathways of each dopamine receptor subtype remains a topic of intense research, and it offers potential avenues for targeting therapeutic interventions in various neuropsychiatric disorders. As we've said, dopamine is a critical neurotransmitter in the brain, and its dysregulation is implicated in various neuropsychiatric and neurological disorders. We've discussed what occurs during depletion and excess dopamine. Now let's take a closer look at a list of conditions associated with dopamine imbalances. Parkinson's disease, a neurodegenerative condition characterized by motor symptoms such as tremor, rigidity, bradykinesia, slowness of movement, and postural instability. Primarily results from the loss of dopamine-producing neurons in the substantia nigra, leading to reduced dopamine in the striatum. There are various classes of medications to treat Parkinson's disease. In this video, we will solely focus on the dopamine agonists since we're talking about this neurotransmitter. These drugs directly stimulate dopamine receptors in the brain. Examples include pramipexole, ropinirole, rotigotine, and bromocriptine. Schizophrenia is a complex psychiatric disorder featuring positive symptoms like hallucinations and delusions, negative symptoms like anhedonia and reduced speech, and cognitive deficits. Hyperactivity of dopamine, especially in the mesolimbic pathway, is thought to contribute to positive symptoms, while hypoactivity in the mesocortical pathway might underlie some of the negative and cognitive symptoms. This disorder is very complex, and dopamine plays a huge role in the symptomatology as well as the treatment options. The primary treatment approach for schizophrenia involves pharmacotherapy, with antipsychotic medications being the cornerstone. These drugs primarily target dopamine receptors, although they can affect other neurotransmitter systems. So let's take a look at our typicals. These are primarily blocking dopamine D2 receptors, and examples include haloperidol, Haldol, chlorpromazine, Thorazine, fluphenazine, thioridazine, and perfenazine. Now, side effects typically show as higher risk for extrapyramidal side effects, or EPS, such as tardive dyskinesia, dystonia, akathisia, and Parkinsonianism. Next, we have atypical or second-generation antipsychotics. These have more diverse mechanisms, often combining dopamine receptor antagonism with activity at serotonin receptors. Examples include olanzapine, Zyprexa, risperidone, Risperdal, quetiapine, Seroquel, aripiprazole, Abilify, clozapine, Clozaril, ziprasidone, Guiadon, paliperidone, Invega, lurasidone, Latuda, acinapine, Safris, brexpiprazole, Rexulti, and cariprazine, Vraylar. Side effects have generally lower risk of EPS compared to first generations. However, they can lead to metabolic side effects like weight gain, diabetes, and lipid abnormalities, especially drugs like olanzapine. Few other conditions include drug addiction and substance use disorders. Many addictive substances like cocaine, methamphetamine, and MDMA elevate dopamine levels in the brain's reward circuits. Chronic use can lead to alterations in dopaminergic systems, contributing to drug-seeking behaviors and addiction. ADHD, a neurodevelopmental disorder characterized by inattention, impulsivity, and hyperactivity. Stimulant medications which increase dopamine levels are often used. Restless leg syndrome, a sensory motor disorder with an urge to move the legs, usually accompanied by unpleasant sensations. While the pathophysiology isn't entirely understood, dopaminergic dysfunction is believed to be involved. Tardive dyskinesia, involuntary, repetitive movements often affecting the face and the mouth, which can arise after prolonged use of certain antipsychotic medications. Thought to result from dopamine receptor sensitization after chronic exposure to dopaminergic agents. Depression. Dopamine is one of several neurotransmitters implicated in mood disorders. Some forms of depression, especially those characterized by anhedonia, or inability to feel pleasure, and reduced motivation, might involve dopamine deficits. Dystonia, a movement disorder that involves sustained muscle contractions, resulting in twisting and abnormal postures. Dopamine dysregulation, particularly in the context of certain drugs, can contribute to some forms of dystonia. Bipolar disorder, a mood disorder involving episodes of mania, or elevated mood and increased energy, and depression. Elevated dopaminergic activity is believed to be associated with the manic episodes. Neuroleptic malignant syndrome, or NMS. Now, this is a rare, life-threatening reaction to antipsychotic drugs characterized by fever, muscle rigidity, and altered mental status. This is thought to arise from a rapid reduction in dopaminergic activity. Make sure that you view our previous video covering NMS. We have already discussed some of the medications used to treat conditions related to dopamine. Let's take it a step further. Dopamine agonists. These directly stimulate dopamine receptors. Examples include pramipexole, ropinirole, and bromocriptine. Uses are for Parkinson's disease, restless leg syndrome, and hyperprolactinemia. Now let's move on to the next class of medications, which are dopamine antagonists. These block dopamine receptors. Some of the most common examples are haloperidol, chlorpromazine, olanzapine, and risperidone. So we use these in situations like schizophrenia, bipolar disorder, and other psychotic disorders. Some are also used as antiemetics. Dopamine reuptake inhibitors. These are going to block the reuptake of dopamine, therefore increasing its concentration within the synapse. Examples include methylphenidate, such as Ritalin and Concerta, as well as amphetamine and dextroamphetamine or Adderall. We can also see cocaine as an illicit drug. Uses are for ADHD and narcolepsy. Dopamine precursors. These are precursors to dopamine which increase its synthesis. Examples include levodopa, which is often combined with carbidopa. Next is monoamine oxidase inhibitors, or MAOIs. These inhibit the enzyme monoamine oxidase, which breaks down dopamine, leading to an increase in dopamine levels. Examples of monoamine oxidase include phenelzine and selegiline. Uses for this medication include depression and Parkinson's disease. Next, we have a class of medication that you might not be as familiar with, so we definitely want to review. This is the catechol-O methyltransferase, or the COMT inhibitors. These inhibit the COMT or COMT enzyme, which metabolizes dopamine, thus increasing its levels. Examples include entacapone and tolcapone, often used in combination with levodopa for Parkinson's disease. Atypical antipsychotics. These have a mixed mechanism of action, often involving dopamine antagonism combined with other neurotransmitter receptor activities. Examples include aripiprazole, Abilify, quetiapine or Seroquel, clozapine or Clozaril. They are used in schizophrenia, bipolar disorder, and adjunctive depression treatment. Other medications include risperidone, which depletes central monoamines, including dopamine, historically used for hypertension and psychosis, amantadine, which was originally an antiviral. It increases dopamine release and is used in Parkinson's disease. And finally, tetrabenazine and duotetrabenazine, which reduce dopamine and are used for Huntington's disease and tardive dyskinesia. Understanding the complex role of dopamine is crucial for clinicians and prescribers for several reasons. 1. Broad physiological implications. Dopamine plays diverse roles in the human body, from motor control in the basal ganglia to modulating mood, attention, and motivation in various cerebral circuits. Understanding its functions allows clinicians to predict and interpret the effects of medications and other interventions. Next, we have diverse therapeutic targets. Many psychiatric and neurological medications target these dopamine systems. Recognizing how these drugs interact with dopamine pathways can guide prescribers in choosing the right medication and predicting potential side effects. 3. Treatment-induced complications. Drugs that modulate dopaminergic activity, especially when used long-term, can lead to secondary complications. For instance, many antipsychotics can result in EPS symptoms or tardive dyskinesia due to their dopamine antagonist effects. Recognizing these complications can lead to timely interventions and better patient outcomes. Number 4, we see complexity in disease mechanisms. Several diseases like Parkinson's and schizophrenia involve imbalances in dopamine, but the exact mechanisms can differ widely, even within a single disorder. For example, while schizophrenia is associated with that increased dopaminergic activity within the mesolimbic pathway, there's decreased activity in the mesocortical pathway. Properly understanding these nuances can inform therapeutic strategies. Polypharmacy considerations. Patients often receive multiple medications simultaneously, some of which might have interacting effects on the dopaminergic system. Understanding dopamine's roles ensures safer and more effective polypharmacy. People can have individual variations in their dopaminergic systems, from differences in receptor density to enzyme activity that metabolizes dopamine. This individual variability can influence drug response and susceptibility to side effects. A thorough grasp of dopamine's role can help in personalizing treatment plans. Next, we have understanding disease progression. In conditions like Parkinson's disease, the understanding of dopamine's decline helps clinicians monitor disease progression and adjust therapeutic interventions as needed. Number 8 is patient education. Clinicians who understand the intricate roles of dopamine are better positioned to educate patients about their conditions and the rationale behind prescribed treatments. This can foster better patient adherence and satisfaction. Finally, we have research and advancements. As our understanding of dopamine continues to evolve, so does the development of newer therapeutic agents targeting its system. Clinicians who are updated about dopamine's role can incorporate new findings into practice more seamlessly. In summary, the role of dopamine in human physiology and pathology underscores the importance for clinicians to have a robust understanding of its functions, allowing for better informed clinical decisions, more personalized patient care, and enhanced treatment outcomes. Thanks for watching. Like and subscribe to view more videos in this series, and join us at www.pmhmptesting.com.